put their microphones on mute if you're not speaking. So thanks for your patience, everybody. My apologies with some of our technical difficulties this afternoon. We had to change format, but we've been wanting to ensure that you had the chance to hear from ACC Nick Bailey, who is leading our strategic coordinating group on the flooding or potential flooding this afternoon across that is expected across Greater Manchester. We're also joined by the Chief Fire Officer, Dave Russell, and I wanted to devote the first half hour of this delayed briefing today to the flooding issues because we think there are messages that the public need to hear before tea time. Work has already been underway in the at-risk areas to inform the public of the risk, and messages have been sent out via various means. But we are obviously relying on media colleagues to see if we can amplify those messages in the remainder of the afternoon. So, colleagues, without further ado, I'm going to hand over to Nick Bailey. We're going to hear from Nick, then from Dave, then open up your questions on flooding. But then we will spend the second half an hour going through the usual slides with regard to COVID. So without further ado, I'll hand over to ACC Nick Bailey. Nick.
Thank you, Mayor. If I start off by explaining to people on the line that this incident and the situation began to be cited over the weekend with information from the Met Office and the Environment Agency, who identified a period of heavy rain that was going to take place this week. The concerns clearly at this stage were around the fact that it was going to be falling on already saturated ground, and the river levels were already relatively high, and this was going to create a situation. It's fairly unusual to get quite so much notice, and it's fair to say that colleagues at the Met Office and the Environment Agency have been working really hard to provide as much information as possible to inform residents, to inform local authorities and responders how best to approach this situation. So at times there has been information that's been provided which has been the information that was the best at that moment. It was right to release that information. It's right that we were using that to prepare our responses. As a consequence of that, since Monday, the partners across Greater Manchester, all 10 local authorities, Blue Light Services, the utilities, the voluntary sector, so the whole range of partners have been meeting under the Local Resilience Forum, and I have chaired the Strategic Coordination Group for our preparations, and colleagues from the Fire GMFRS have been chairing the Tactical Coordination Group. So from that point on Monday, we were providing warning messages to the public. There was going to be a situation with heavy rain and potentially a major incident. That was declared Storm Christoph earlier on this week, and probably just get this message across to lots of people just in case they're expecting what they usually associate as a storm. This storm is more a persistent rainfall as opposed to high winds or really torrential rain. It is that consistency of that rain over probably a 48-hour period that is going to cause the issues across Greater Manchester in terms of saturated ground and river levels, which are going to lead to flooding. So our strategy from the beginning is always to make sure that we protect lives of anybody who may be impacted by any kind of disaster like this. And that was further complicated, obviously, now by the fact that we are in the middle of a pandemic, we are in a lockdown, and clearly that presents its own risks in terms of if we have to go to evacuation, if we have to carry out any rescues, or if individuals feel that they need to take action themselves to protect themselves and their homes. So we were really keen to get the message on, and I'll come to that message shortly around that. But we also, in addition to protecting life, we also need to make sure that we've got key strategic sites that are protected, and that can be anything from utilities to transport hubs to travel hubs, or in this case, even vaccination and test centres that we needed to look at, and clearly seek to minimise the disruption to travel. We have been working with
3614.
We have been working with partners across the spectrum. And normally what we would try to do when we have an isolated situation is probably prevent any kind of catastrophe occurring. So in the past, we may want to pump water from one area to another to prevent flooding, or we may want to raise barriers to prevent the direction of water going to certain areas. The situation that we've been presented in this scenario is that the limitations on pumping really are around the fact that there is nowhere else to pump the water. And this is a situation that's been brought about by the contingency plans around our river systems actually being used, and then being unprecedented rainfalls, which actually, totally fill those contingency plans. And likewise, there's limited, if no assistance that can be offered other than maybe in individual properties for sandbagging. But as a strategic tactical option, it's not considered something we can do successfully. Initially, when this first came about, the significance of this event was because of the impact it was going to have, or predicted to have, on our main river systems, and that will be the River Irwell around the Douglas and its tributaries, and the River Mersey. I'm pleased to say that over the past day and overnight, whilst not eliminating the risk, the more serious risks presented by and around the River Irwell and the River Douglas have reduced. But it is fair to say that the Met Office are still stating that we are going to have significant rainfall, and that is still going to cause flooding, drains being full, roads being blocked, fields and other areas will flood just because of the sheer volume of rain that is falling and the type of environment it's falling into, which is already sodden. So again, a lot of work by the Environment Agency, local authorities, trying to drain gullies, clear drains, making sure known hotspots are dealt with. But at the same time, there has to be a recognition that there is going to be some inconvenience to people who are out and about at this time. And there may be some really localized flooding to properties that won't be cited by the more strategic oversight. So where we stand as of this morning in terms of risk are that the risks that are around the River Mersey are the main risks to the Greater Manchester area, and they relate to the River Mersey and its surrounding areas of Didsbury, Northern, and then Sale, and potentially leading into parts of Stretford and Flixton. As we speak, residents across those areas are being contacted by the Environment Agency and local authorities to advise them about the situation. Alerts have already been put out, and they are being advised to consider evacuation procedures should that happen. The information we had as of this morning, and as I say, this is a changing environment subject to the weather, but the information we had of this morning is that we are going to start to see the overflow contingency provisions starting to overflow around 5 p.m. this evening in the areas around Didsbury and Northern. And that will reach a peak at around 11 p.m. this evening, where we will see flooding of those areas. In its worst case scenario, as estimated by the Environment Agency, that could impact on up to 3,000 properties across all the areas that I've mentioned to varying degrees. So this is a significant incident in terms of disruption to the population. And as I say, those people have been advised with regards to action to take. What I would say, and I think we do have the slide around evacuation, what I would say and sort of support people with is there may be people in their homes who are really and rightly still worried about COVID and infections. What we have done across the partnership, and particularly with the local authorities in Manchester and Trafford, is work with those agencies to ensure that where we can put provision in place, it is COVID safe. So first and foremost, what I would say though, is that where people do feel the need to evacuate, where they do feel the need to take action that will prevent them being harmed or their homes being damaged significantly, then what I would say is we actually need to make sure that people do take that action. They do make sure they are safe. The legislation around COVID will not be applied. There are exemptions for this type of thing. And if you need to take action where you are having to join other bubbles or go to other properties, then what I would say is please do that if that is necessary to protect you and your family and your property. What I would say though is if you do that, remember COVID is still present. We should remember the rules around stay safe, about social distancing, keeping windows open, minimizing contact where that is at all possible. If you feel that this is still too risky for you and your personal situation in regards to COVID, my suggestion is that you do contact your local authority in regards to your concerns, and provision is being put in place by the local authorities for COVID safe rest centres and in extreme situations, provision for alternative rooming should that be required. In regards to whether you feel you are in one of these risk areas and haven't been contacted already in regards to a flood, the numbers are there on the screen in terms of flood line. There are local numbers there that you can ring. You can contact your local authority. First and foremost, I would say in an emergency, if you really are unsure, please do call 999 if you have to. But if possible, please keep a track of this on social media sites, on flood warning sites with the gov.uk web pages, and monitor it and be aware that it does change frequently. So you have to keep monitoring those sites. We will, and throughout this period as the police, we will maintain a presence in any areas that have to be evacuated to ensure that properties remain safe and that residents can feel assured that their properties are safe from any other issues if the flood does occur. In terms of practical actions that people may wish to take, provision is being made for vehicle parking outside of the flood areas so that clearly vehicles don't become a hindrance to any emergency vehicles or damaged as part of this flood. So there is options to move vehicles. In addition, the obvious steps in regard to moving a personal property to higher levels to avoid the damage that a flood may have. I think that is all I would want to say. We remain on 24/7 in terms of a partnership. We will be on all evening. Sadly, when the rain stops, this situation will not stop because the rivers and ground will still be damp and we will still have to manage and support that aspect of the situation. But I think that covers it, and I will hand you over to Chief Fire Officer Dave Russell.
Thank you, Nick, and thank you, colleagues. Nick has covered off the key points. I think just in terms of impacts on Greater Manchester Fire and Rescue Service at this point in in time, they are relatively minimal. So I just want to give an assurance on the call that we, as it stands at the moment, are not receiving high volume of calls to respond to flooding related incidents. Nonetheless, we remain alert to what is a very dynamic situation. Just in terms of the service, we have a very good and a very robust capability to be able to respond to wide area flooding. That includes access to specialist boat teams, it includes access to high volume pumps, and indeed every operational member of staff within Greater Manchester Fire and Rescue Service is trained to deal with incidents involving both static and moving water. The small incidents that we have attended this morning, and there's a very important public safety message in here, is that has been people that have become trapped in their vehicles whilst trying to pass through roads that have surface water. Clearly, there should be no attempt to move along road networks where there's standing water. So there's a real strong public safety message there. Really, don't make any journeys at all unless it's absolutely necessary to do so. In terms of activity so far, obviously we're plugged in and we are supporting the local authorities. So that's firefighters on the ground playing a role in terms of warning and informing. And as Nick alluded to, we do have an opportunity here ahead of the projected impacts to be able to convey the key public safety messages that Nick has provided and make sure that residents are as well prepared as they can be if indeed the impacts play through, as Nick has alluded to, which at the moment, certainly for us as a fire and rescue service, do focus heavily on the basin in the Didsbury area, which is linked into the River Mersey. Just one final point. I mean, all fire and rescue services across the United Kingdom do have access to national resilience assets. So that is a capability to bring in specialist water assets into a fire and rescue service to complement the host fire and rescue service. So I've given an early notification of that. We haven't made that request at this particular point in time on the basis that there is a confidence that the resource base that we've got within Greater Manchester Fire and Rescue Service will be able to support the weather events that we're expecting on the back of Storm Christoph. Thank you.
Thank you, Dave. Thank you, Nick, as well. So, colleagues, we thought it was important that you heard at length from both Nick and Dave. If I could just emphasise the advice slide that Nick displayed, in case there's any confusion out there amongst residents. If people need to leave their property to protect themselves, their family, or their property, they are able to do so. But we would obviously hope that they would do so in the most COVID secure way. So we don't want there to be any confusion about that. And that is advice that has been issued by the government earlier today. So people do need to know that they can take that action to protect themselves or their family or their property if they need to do so. In the Didsbury and Sale area, we have opened TFGM car parks. So we are advising people if they wish to move their vehicle to a safer area, we're trying to facilitate them to do so. There has been a huge amount of activity going on in the affected areas. Manchester City Council teams going door to door. Also leafleting has been carried out. So we've been trying to contact the public in a number of ways. And I'd like to thank everybody who's been out there doing that work. But obviously we are now relying on all of you, all of our colleagues in the media, to help get the messages out in the next couple of hours, because we're entering the most challenging period. As Nick said, there is an expectation that there could be an overtopping of the flood basin around tea time, around 5 o'clock. So obviously there is an urgency now in getting this message through to the public. So I will leave it there, Ross. I was going to come to you to take us through any questions. Obviously, we've got 10 minutes or so, and principally we'd be wanting colleagues to put questions to Nick or Dave, and I'll be available for questions in the second half of this briefing.
Thanks, Andy. So what I've asked colleagues in the media to do to try and make this easy is if you could indicate in the chat if you would like to ask a question, and then we'll come to you rather than just going through the list, and colleagues may not want to ask questions. So if you just put something in the chat, question please, or me, and then we'll come to you. Josh Halliday's done that. So Josh, would you be okay to ask your question?
Yeah, thanks very much. Thanks very much, Nick, for all that information. Could I just check when you are speaking about the up to 3,000 properties potentially impacted? Are those properties that you think are likely to have to evacuate tonight, or you just think they will be affected by flooding, but they may not have to evacuate? And do you have any idea of how many properties are likely to have to evacuate this evening? Thanks very much.
Thank you. We start off with a worst case scenario in the hope that we can plan for the worst and hope for the best, as it were, really. So that 3,000 is a worst case scenario where we will look to try and apply sufficient resources should that be the case. Now, we are sort of almost every couple of hours reviewing the data with Environment Agency, the information on the ground, to try and work out how much their predictions are going to manifest in terms of the impact. So we will try our best to make sure that all those 3,000 get the right information, get access to the warnings, but we will work with them to ensure that right up to the last point where it's safe to get evacuated, that we will minimise the disruption. But that inevitably means that sometimes people will have to evacuate when they thankfully didn't need to, but as a precaution. So I can't really give you the latest figures. It's a constantly changing one. We can get sucked into figures, but I think actually the best thing for us to do is be on the ground helping the local authorities and overwork it rather than underwork it and try and reduce that number.
Thanks very much. Just so I'm clear then, those 3,000 may have to evacuate, but it's not certain.
Yeah, that's a worst case scenario. Some of them may be evacuated because, they've got a really shallow pool of water that's around their property. So it may not be large impact. It just may be that the water reaches their property.
Thanks very much. I've got a question from Stephen. I think his microphone's not working, so I'll ask the question for him. He's asking whether the Salford River Irwell is now a reduced risk. Is there no danger of flooding? So Nick, put that one to you in the first instance.
It is a reduced risk, but as I said at the beginning, that there still may be, high levels of water and in pockets there will be an overflow. Even from the basin, which has been created as a contingency. But in terms of how that's been rated from the Environment Agency, that has not been created as a significant or severe risk. But obviously that means it will be managed locally by the local authority, and if necessary, there will be the support from local fire and policing teams, but that won't be significant in terms of that resource.
Thanks. Dave, is there anything you wanted to add to that, or are you quite happy?
That's fine. Nick's covered that off.
Fab. Andy, I've got no other questions for this section of the press conference at the moment, unless anybody else has any last minute questions they would like to indicate. In that case, Andy, I think we'll move on to your section.
Yeah, we should release Nick and Dave back to their important work. So thanking both on behalf of everybody on the call for attending, and obviously sending them all of our best wishes for everything this evening.
Andy, apologies, just Nick, before you go, there's a question from Rowan Bridge at BBC 5 Live, just asking someone explain a bit about COVID-safe rest centres, where they will be and how they will operate, just given the importance of that question. I thought we'd just ask it before you go.
Yeah, okay. I know Manchester City Council have, from previous planning, when COVID came about, we reviewed our evacuation plans right across the partnership. So what they have in terms of a COVID safe centre, it is a location which they may have used previously. I confess I don't know, but it is one of the forums locally in their area. And the reason it will be COVID safe is because in the past it would have been able to take a certain number of individuals in that property and provide them with support. And it's been made COVID safe more now, a lot by reducing the numbers of people that are allowed in there. But there will be obviously areas where people can't go, one-way systems, sanitizers that people can use, and limiting the numbers of people in there. So that might mean if that gets used excessively, they would have to extend the number of places that they use as rest centres.
Thanks very much. I think that's us now in terms of questions.
Thanks, Ross. So again, thanks to Nick and Dave, and we'll move on, colleagues, to the usual slides with our latest health stats. So if I may ask Kevin to put up the first slide. Hope everybody can see that. What this shows is a decrease overall for Greater Manchester over the last week, down to 392 cases per 100,000. All of our boroughs recording a smallish decrease. In the case of Bolton, barely any, but for most of the others, a small, modest decrease. But nevertheless, a decrease overall, and the figure 392 still puts us significantly below England average, which is closer to the 500 mark. So it's welcome news, and it's clear evidence that the national lockdown is working. What we haven't seen is the same level of decrease in over 60s, and that's obviously something that we keep a close eye on. So we could go on to the next slide. You can see the age breakdown here, and obviously the right of the slide is the most recent data. You can see it's there for all age groups, if you like. The line is slightly darker, but particularly so with regard to the youngest age range, 16 to 29. You can see a significant darkening of the line towards the right. And the reason why this graph is important today is because, in effect, this is the Christmas and New Year effect, having now fully fed through into the data. You may have heard us say for a few weeks now that we were waiting to see the full effects of that feed through. Well, I think we can see that. It suggests that there was perhaps more social mixing amongst the younger age groups over the Christmas and New Year period, less so amongst older age groups, although I did just obviously mention that we have a concern about the infection rate in the over 60s. So that is the picture with the age breakdown. This slide reflects increased levels of testing across Greater Manchester, and that is linked to the support we've had from the military to stand up a lateral flow testing capability across our 10 boroughs, and the effects of that now are feeding through into these figures. So 3646 is the highest number of tests I think we've recorded, and that's a product of obviously having that increased accessible testing capacity. Thank you. Next slide. This is a slide you're familiar with. Percentage of care home residents with COVID-19 or showing symptoms, a slight upturn in those numbers, which of course is a cause for concern, although they remain much lower than they were last year in the first wave. Just to provide a quick bit of context as well around this with regard to the vaccination programme. The Greater Manchester Committee was updated this morning on the progress of the vaccination programme within care homes. As of, I think, the end of last week, 65% of our care home residents have been vaccinated. And over the course of the next week, we're expecting to complete that for all care homes and care home residents in Greater Manchester. So that's real progress, and obviously will increase the safety of care home residents. If we move on to the hospital figures, what we can see there is the effect of the third wave feeding through and continuing to feed through in the numbers. So weekly admissions are up again from 204 last week to 236, and the number of inpatient diagnoses increasing from 615 to 736. So obviously increased pressure on our hospitals with regard to what that means for beds in critical care. 157 people currently in critical care beds and 181 people in other hospital beds, both of those figures representing an increase on the week before. Latest modelling for our hospitals, Sir Richard Lee's updated the committee this morning, suggests that we will hit the peak of the pressure on the NHS over within the week, but probably in about a week's time is what people expect. So at some point next week, we will kind of hit the peak. But what we do not expect is for there then to be a sort of rapid downturn the other way. We think it will be a sustained high level of pressure, a sort of plateau effect of the pressure, and it will continue, it's anticipated, for around 3 weeks. So the position will be extremely challenging for some weeks to come, and we know how hard our NHS staff are working, and we're very conscious of what they are doing and everything that they are contending with at the moment, and we're hugely grateful to them. I don't think we need to dwell on that slide. If we could move on, I think this will be more interesting to colleagues. This is a slide on obviously progress on vaccination across Greater Manchester, and that is a new figure as of this morning that we're able to give to you today. So 195,000 people within the priority groups have been vaccinated. Have to say, I mean, that does represent a huge collective effort across Greater Manchester of staff working in our primary care settings, in our hospitals, also in the mass vaccination centre, supported by volunteers who are coming forward. Huge amount of work going on, and all of us today wanted to just convey to them a message of genuine gratitude for everything that's been done. We've stood up around 75 vaccination sites now across the city region, and as you can see, that the level of progress really has kicked on again this week. And I think if you look at it in percentage terms, we are about a third of the way through that kind of first 4 priority groups. Overall, there are around 560,000 people who need to be vaccinated to meet that mid-February target. Well, we're about a third of the way, a little more. And if we sustain this level, then it is doable. It's challenging, but certainly doable. Good supply of vaccine has been received across Greater Manchester this week, but first signs that maybe next week there will be some reduction. So we obviously want to work closely with the government on this. With the right supply, we believe we can continue this strong rate of delivery, and we'll want to see if we can work with the government on that. So I'll finish, I think, on this slide today, and it was just something which NHS colleagues wanted us to bring to your attention. This is a new service that's been launched by the NHS nationally, 111 First, which people can reach by phone or online. And it's about people being able to be booked in to be seen in an urgent care setting, so that they can go at a time where the pressure on the system might be better managed. So it's about making it easier for people to get a booked appointment and also therefore helping the NHS relieve the surge that they can sometimes see. So it's 111 first is the service, and we just wanted to alert colleagues in the media of that today. I think that is it for the slides. So Ross, I'll probably turn straight back to you for colleagues' questions, given the length of time that we've kept people today already with our technical difficulties. We'll get straight into questions.
Thanks, Andy. Just to say, we've had 2 people indicate they want a question at the moment. If any other colleagues do want to ask a question, please just indicate in the chat, just say, I'd like a question, please. That's absolutely fine. I'll come to you. Someone who's done that's Kevin Fitzpatrick from Radio Manchester, so we'll go to him first.
Yeah, a couple of questions. On the vaccines, what are the key issues and milestones that you need to keep focus on locally to ensure that we do keep on track to lift some of these restrictions as soon as possible? And also a question about this story knocking around about lots of the businesses, particularly some of the pubs who were promised government money, grants to help them get through this period. It sounds like maybe as many as 3/4 haven't received them yet. So are you doing anything, having any conversations to try and speed up the process of getting that support money to the businesses?
Thanks, Kevin. So on the first question, the reason why we're publishing this data every week is to create that sense of a milestone every week towards the target. And I think the figure we gave you last week was in the 90,000. So what you can see is a significant increase in delivery over the last 7 days. And that is the type of run rate that we will need to maintain to hit the overall target. But we are now managing that level. It's important to say as well, and I didn't say it when I gave my introductory remarks, that we are now going into the other priority groups within the top 4. So if Kevin wouldn't mind just showing that slide again, just so colleagues know what they are and the numbers involved. Kevin, can you? Thank you very much. So as you'll see from that slide, so care home residents and staff, as I said, we were, last time we checked, which was a number of days ago, we were 65% of the way through. And that was earlier this week. And a huge effort is underway to complete all of that over the next few days. So by the end of this week, early next week. Then obviously there's been a huge amount already being done with regard to over 80s. But now they're beginning to vaccinate people between the ages of 75, 79 and 70 to 74. So that's the next part of the work, Kevin. So we're going into those age groups now. And as I say, we're making really good progress. The issues that might be barriers to that progress are, number one, supply of vaccine. And I think that remains the biggest concern. We have had some issues around delivery in the Salford area this week, where there were appointments that had to be rescheduled because of a non-delivery issue, and some reports that some localities not receiving all of the vaccine that they were expecting next week. So these are the kind of issues that we need to continue to work through with the government. We are asking for a little more flexibility at local level to match vaccine to the areas that need it. But there's good cooperation going on all of these issues. The data is coming through to our directors of public health. So there is good progress being made. And we just want to continue to work in that way and hit that February milestone. Because as you're indicating in your question, with Greater Manchester below national average with regard to the headline case rate, and now decreasing again, as we were in December. You'll remember we were coming down in December. It would appear that we've had another increase in spike in January, but the national lockdown hopefully is now bringing us down again. It puts us in obviously a stronger position than we've been before with regard to the exit from national lockdown. So those conversations haven't started in earnest yet with the government, but I guess they will start over the next couple of weeks. On your point about the non-payment of grants to businesses that have been closed, obviously that's an automatic payment that should be made, that comes via government funds. Certainly our nighttime economy advisor has raised this issue with us, and there is some work underway to understand the reasons why those grants haven't been paid. So all I can assure you, Kevin, is that we will do everything we can to unblock any problems there and ensure the money gets through to those businesses.
Thanks, Andy. I'm going to go to, thanks to colleagues who have indicated they want to ask questions. I'm going to go to Alan from Politics Home.
Hi, Mr. Burnham. I just wanted to ask you, yesterday the Deputy Chief Medical Officer for England, Jenny Harries, said that schools will likely have to reopen on a regional basis, and suggested that some places like London and the South East, which are a bit further along in terms of driving down new infections, having had the new variants before other parts of the country, that they might open there first. Do you accept the idea of regional reopening, or do you think that schools, it should be a national decision rather than a local one, because obviously, you know, the impact that it has on pupils? And just secondly, you talked then about the delivery of the vaccine. I just wondered, had you had any detail from the government about what the problems are with some of this vaccine delivery and why it's not going right the speeds that some people have been looking for?
Thanks, Alan. So on your first question, I think I would come back to what I said when the debate was happening about whether schools should close, and that is, let's trust head teachers working with local authorities and directors of public health to make the right decisions, because even within a region you can have huge variation. So there is a very large variation between what's been happening in Greater Manchester recently and the Liverpool City region. So I think the problem comes where there is an attempt to create these blanket situations, and we've had this with school closures all the way through. If you remember last year, there was a date given of June, and all primary schools should open at the start of June, and that led to some areas delaying because they felt it wasn't right. I think the right thing, I believe, from where we are now, is a national signal given about a date from which schools may be opened, and then obviously left to the judgment of experts on the ground, directors of public health working with head teachers to get things right. But if I could just say a couple of further points on that, Alan, I think the whole idea of reopening schools, I think, would be strengthened if we can resolve the issue around vaccination for teachers and school support staff. I think that is an issue that's being looked at by the JCVI at the moment, but I think the case is clear to prioritise teachers and school support staff, as we said last year, and I certainly think that needs to be looked at. But finally, if I could just make one further point on this issue, if there was to be a region by region approach to opening schools, which I have to say I'm not necessarily in favour of, as I've indicated, that would have implications again for whatever is decided about exams or assessment at the end of the year. Now, it hasn't gone away that there may be some form of standardised assessment or basic exam to inform the teacher assessed grades. That clearly would not sit well with a regional reopening of schools, because some young people stand to be seriously disadvantaged by that if they have then to spend more time out of the classroom. So I just think all of these issues, we seem to be living hand to mouth on all of these issues. And I think we need rather than suggestions of a regional opening and all the implications and kind of confusion that potentially causes, I think we need a clear plan laid out for how all of this is going to be managed. I would say create a date by which schools can open, trust people at local level then to make the right judgment about when it's safe in that particular community, support people with testing and vaccination to enhance confidence around school reopening, and then make the necessary, ask Ofqual to make the necessary changes to the assessment of young people, so that there is no detriment at all to young people who live in areas where school opening has been delayed. The second question, Alan, remind me.
Sorry, it was just about you mentioned some of the issues around vaccine delivery, and you've heard anything from central government about what that actual issues are. They just say that there are problems with vaccine delivery, but they don't really sort of give details of what that actually is. And just wondered if you've managed to tease any information out about what that means.
No, the group of mayors, the M9 group of mayors, had a really constructive meeting with the vaccination minister, Nadeem Zahawi, last week. And he expressed to us a growing confidence in the supply line going forward, and we certainly felt that this week. What has happened in the last few days is some reports in the media, but also some sense now that localities are getting less than that they were expecting. So, I mean, these are matters for the government. I wouldn't want to be in any way talking up these problems. We want them to be resolved as soon as possible. But it does seem that in the last day or so, some doubts have crept in about the confidence levels in the supply line. But all I can say in terms of the delivery system, which is what obviously colleagues here are responsible for, is it's there. We've just given you the evidence today of how much it's doing. It's had a big week so far in terms of delivery of vaccine across Greater Manchester. That is fantastic to see. So the system is working, it's delivering, and we just need that supply to continue. There is a worry maybe later down the line in February as we hit maximum delivery that we might have staffing issues, but they are being managed at the moment. So we've got an eye on that issue. It is supply that is issue number one at the moment with regard to hitting the mid-February target.
Thanks, Andy. Going to go to Jen Williams at the MEN.
Hi, Jen.
Sorry, I'm trying to type and think and unmute myself all at the same time. I just had a question about hospitals. We're obviously heading for the peak in the next week or so. If we hit capacity during that time and we're not able to access mutual aid because of the pressures that the rest of the Northwest is under, do you foresee a situation where patients might end up being treated in corridors and the backs of ambulances, as we've seen in other parts, well, London largely, or children's beds being opened up to adults, which I think has happened at Alder Hey? And a second question related to the one about schools, but more broadly, would you support a lifting of restrictions after lockdown region by region more generally, aside from schools? Or do you think that everybody should come out of the lockdown into the same set of restrictions? Thank you.
Thanks, Jen. So on the first question, I think the position in the Greater Manchester NHS is probably not as severe as we've seen in other parts of the country, particularly London. That's not to say that it's not extremely challenging, because of course it is. So figures I gave today obviously are increasing for numbers of people in hospital beds, and it's not at the peak. If I were to give you a projection for the current projected worst case at the peak, it would be around 200 people in critical care in Greater Manchester. That's the current expected level of the peak. And beyond there, that isn't sort of full capacity, if I could put it that way. There are still significant additional beds on top of that would be available. But let's not forget, obviously people are still coming in to need critical care for a whole range of reasons, as they would normally do. So, it's tight and it's challenging. But at the moment, we are actually providing a little bit of mutual aid to other places, recognising the fact that we just have that little bit extra within the system compared to other parts of the country. So, we don't know necessarily exactly how the next few days are going to play out, but I hope we will avoid some of the kind of scenarios that you were describing. But we can't rule out the fact that there may be some challenging situations that arise. We have a situation that is a little different in some of our, let's say, more medium to smaller size hospitals, where they are much closer to capacity than some of the bigger institutions in the conurbation. So pressure is greatest in terms of on beds in some of the outlying district general hospitals. So all of that is kept under review. But as you know, Jen, we manage this as a Greater Manchester system. On the second question, this is, I think, the discussion that needs to be had. I indicated last week, I think, that I just have my doubts about the tier system and the extent to which it works. The confusion that different arrangements creates within a region is a real problem. And in the case of tiers 2 and 3 in the run up to Christmas, when you have shops or hospitality open in one area and you don't have that in another, of course you create incentives for people to move around, and that doesn't necessarily create the conditions by which you contain the spread of the virus. So I think there needs to be a kind of a new discussion about what is the right exit route from national lockdown, and that hasn't begun in earnest yet. I think simply returning to the old tier system, I would personally have my doubts about that, because I expressed it before. To have no restrictions on non-essential retail, but heavy restrictions on hospitality in tier 3 or closure. I don't personally feel that the balance was got right in those earlier tiers, and I think I would hope we might be able to have another discussion about that coming out of this situation. And if there were, I would prefer national arrangements if they could be justified in a way that we had national arrangements coming out of the first national lockdown, and they persisted for a time before the first regional restrictions came in. Now it's all going to be linked to the case levels, isn't it? And there's a lot that's up in the air. And as we all have found throughout this, when you make predictions about cases, based on the evidence before you on any given day, it can change very quickly. So it all needs very careful consideration. I think erring on the side of caution in February will probably be wise, given the situation with new strains. But I do have a worry about going back to the regional tier system as it was previously conceived, because I think some honesty is needed about the extent to which it worked, because I think there are real doubts about that.
Andy, Hannah Miller at Granada.
Hello, thank you.
Hi, Hannah.
Hiya. A lot of what I was going to ask has been covered, to be honest, but have you had any indications that there might be issues in the take-up of the vaccine in sort of certain communities or certain neighbourhoods, areas of Greater Manchester? Is that something that's being discussed? Is it a worry, or is it, it's something that we've heard being discussed kind of nationally, but is it something you're seeing or not?
We have a worry about some of the material that is being put around about the vaccine and the whole pandemic being a conspiracy. And one of our leaders today reported that there's leaflets going through people's doors, even in parts of Greater Manchester, using the national branding, but obviously having anti-vax and anti-lockdown messaging on it. So there is a concern about that. I don't think our figures would say to you, Hannah, at this moment in time, that there is any issue about take-up. I think, if anything, it's the opposite. I think people are, wanting to take up the vaccine, and that's certainly been the early experience. But it's often the older age group, I think, who are wisest on these things, who've obviously lived life in their earlier life without vaccines and understand how bad it is when you don't have vaccines for certain conditions. So I think the wisest people in our society are often those over 80s or so over 75s, and I think they understand it really, really well, and probably will give short shrift to the anti-vaccine lobby. Maybe those issues will creep in as we come down the age the age range, and obviously we would want to work with all community groups to counter that kind of messaging. So we will work with all of our communities. We'll make sure that all different languages. As of today, we are not seeing any problems with take up, but I do anticipate that could become more of an issue as we progress down the age range.
Thanks. We'll move on to Dan Whelan from Place Northwest. He's written his question, so Andy, I'll just read it out to you. On the Manchester Nightingale, it was announced by Health Minister Lord Bethell that the national cost of the Nightingale hospitals would exceed £5. What was the cost of setting up the Manchester site? Is it currently being used? And if so, how full is it? And do you think it was a good use of funds?
Thank you, Dan. The way I would, let me first say that the cost of it is not a cost that's been borne locally. It's a cost that is accrued by NHS England, and really the question would have to go to them as to the precise cost of the Nightingale facility at Manchester Central. How many people are in? I'd have to get you the latest figure. That it's varied, and there have been double figure numbers throughout the winter period, but we'd have to get you the precise numbers. It is linked to patient choice, of course, so it's hard to predict how many people will use it at any given time. Was it a good use of funds? I mean, I don't want to play politics with this in any way, shape or form, because I think the way to think about the Nightingale is not so much of how much was it used. It was more an insurance policy for the pandemic. So in a really worst case scenario of the kind that was seen in Italy or in Spain at points last year, it's there as a backup plan, an insurance policy. And I can understand why nationally that was felt to be needed. I think if I cast my mind back to the national pandemic plan, which has been in place for a number of years, certainly when I was in government, these things were in the national pandemic plan. So it's long standing that there may have needed to be capacity of this kind stood up. So there are things that I would challenge the government on. I wouldn't necessarily go to this as my main challenge. It has been used. It's been used more though as a backup plan, and I think to that extent it's created some sense of reassurance that capacity could be managed.
Thanks, Andy. Nigel Barlow.
Hi, Andy.
Hi, Nigel.
You all right?
Yes, thanks.
What is the future for Metrolink post-COVID? A report yesterday by its chief executive doubted that passenger numbers would recover for a number of years, and despite government support, last 12 months it's on track to lose £64 million. Also, given that it looks like the lockdown is going to continue well into March, if not to Easter, are there any plans to scale back GM public transport as in the first lockdown?
Just repeat the last bit, Nigel. I missed the last bit. Are there any plans
to scale back GM public transport as in the first lockdown?
Thanks, Nigel. Just on the last bit first, not at this stage, no, in terms of Metrolink. So we have a funding package in place for Metrolink until the end of this financial year, so to the end of March. And obviously we've been running on a reduced timetable throughout most of last year and into this year, but we will maintain that level of service going forward. There has been some discussions about a slight reduction in bus mileage across the city region, particularly where there are emptier services that are not being used. But that's being done carefully, and I don't think it will result in massive changes. In terms of the sustainability of Metrolink going forward, you are right to point to the fact that it's unlikely that there will be a kind of return to 100% passenger levels that we saw pre-COVID, the minute that we're beginning to emerge from restrictions, because some people's work habits will have changed permanently as a result of all of this. So the predictions are that, you know, the passenger numbers will not return to what they used to be straight away, and there'll be a sort of steadier sort of kind of journey back to full utilisation. What the effect of that means to me is that the government is going to have to subsidise transport outside of London to a level it's never done before for some time. But that's what they've always done for London. So what we need to do is create a kind of plan here with the government to manage that process, but also to use it as part of the improvements of public transport coming out of COVID. And as you know, Nigel, we have a plan for a London-style integrated public transport system in Greater Manchester, and we want to move that forward this year. And we want to work with the government to see how that best can be done, recognising that we're going to have to help public transport recover, but at the same time, let's also help it improve. And that's the discussion I think that we need to have as part of the levelling up of the country that the government is talking about coming out of this pandemic. We were concerned last week about some of the cuts to transport for the north, to integrated ticketing, potential freezing of the development budget for Northern Powerhouse Rail, not a good sign at all. And we would just say to the government that, levelling up has to become real coming out of this. And we have to have plans for northern transport that make good on the promises that have been made. And that applies to intracity transport of the Metrolink kind, but also to intercity transport as well.
Thanks, Andy. The final two questions, one will be from Tom, which I'll read out in a second, and then it'll be Adam Clark. And then if you get any final points, I'll read out Tom's question because he's having some connection problems for Business Live. If the lockdown goes on right through until March and April, do you think Manchester's businesses can survive until then? And do you fear we'll see more closures? And the second question is, with the COVID infection rates dropping across the board, are you hopeful Manchester will be one of the first to be released from the full lockdown and back into the tiers?
Thanks, Tom. Well, obviously, it's a really challenging picture for business, isn't it? And we're monitoring the situation really closely. We're working with the councils at the moment to ensure that whatever funds we have got to make available, we are getting out of the door. Although, when the funding was given to councils, the government was saying that they'll have to make it last for a long time. So it's a tricky balance that the councils are managing at the moment. The need to provide support, but at the same time recognising that we don't know that this will end in March and April, and it's a difficult picture to predict. But yes, of course, we have those concerns. We are monitoring the situation closely. With regard to the numbers of businesses making redundancies. I mean, the key issue, of course, is the decisions around the furlough scheme, because I think that the way that is handled will have a big impact on businesses in that March-April period. So we do fear the damage that has been done to the Greater Manchester and the northern economy. We've said that before. It was at the heart of the concerns I expressed about the original Tier 3 debate last year. We think the poorest parts of the country have been hit hardest by this virus, both from a kind of people point of view, but also from an economic point of view. And there is going to be a lot of heavy lifting needed to level up this country coming out of this pandemic. In terms of our hopes coming out of this national lockdown, well, as I've been saying today, we do have a lower overall case rate at the moment than the England average, and we are seeing reductions now in all 10 of our boroughs, which is encouraging. We're making good progress on vaccination, which is also encouraging. We have targeted mass testing in place in our 10 boroughs. We are pretty well set up. However, there is a however. What isn't working properly yet is test, trace, and isolate. And it's so frustrating to say that, given how many times we've raised these issues on this briefing. one of the concerns that is being expressed a lot at the moment is the isolate side of this. So we're doing a piece of work with our 10 councils at the moment around the payment of the self-isolation support grant. And what we're seeing is a lot of people being refused, and our councils are saying to us it's because of the eligibility criteria that have been set for those payments. So that whole question of self-isolation support has never been properly dealt with. And how many times do we need to say it? Unless you fix the whole of that chain, test, trace, isolate, you won't have a kind of a successful system to guide us out of restrictions. And really, now we should be getting all attention, because we've got to focus on vaccination, but we need some attention on test, trace, and isolate, so that we can manage the exit route from all of this. So I think we're in a strong position in Greater Manchester with lower case rates, successful progress on vaccination. I think that probably does suggest that we are in a good position. But as I was saying to Jen Williams before, to go back into the tiers of old, I'm not sure that's the right answer. And I think there still needs to be further discussion with the government about what is the right release from national lockdown.
Thanks, Andy. A final question from Adam Clark, and then if you've got any final thoughts before we finish.
Thanks, Ross. Andy, just a question on face masks on public transport. We've seen Transport for London publish figures this morning to say that 1,700 fixed penalty notices have been issued to those that haven't had face coverings in public transport and haven't been exempt. Do you have any figures for Greater Manchester on that?
We do, Adam, and there have been fixed penalty notices issued. I don't, if I'm honest, have the latest figure to hand, and I don't know if any one of my colleagues can help me, because there was a figure of 300 or so was the last figure I think that I was given. But Adam, if I could endeavour to get that sent to you after this press briefing, we would strongly support enforcement on public transport. It's easier on trams than it is on the buses, but we would obviously support what colleagues in London are doing, particularly with the risks that the new strain presents to us. But we can get those figures to you if that's helpful. Ross, shall I just wrap up then and thank everybody for their patience this afternoon? I appreciate we kept you waiting, colleagues, and I'm sorry we had to switch platform, but we managed it successfully. We would be grateful for anything that you could do to put out the messages given by Nick and Dave Russell earlier. The important thing is that people have a little bit of time to take precautions and to put themselves in a position of safety. So the number's gone back up on the slide there. So anything you could do to support us on that. We don't want to alarm the public. As Nick was saying, the risk has reduced in parts of Greater Manchester, but it remains high in the areas in South Manchester, close to the River Mersey, particularly Didsbury, Northenden and Sale, and parts of Trafford, Stretford and Flixton. So thank you, colleagues, for anything that you can do to support us on that, and for attending this press briefing. As normal, I think a little glimmer of light today in terms of hopefully our exit from national lockdown, things beginning to turn in the right direction in Greater Manchester, certainly on vaccination. Excellent progress to report there. Thanks for joining us, everyone, and we will see you again next week. And thanks to the team for the swift action to get us on this backup plan. Thanks, everyone.